Hopkins serves the same function as an air traffic control center in the aviation industry. Imagine yourself flying in an airplane, and you're flying home to Baltimore. So can you imagine flying into that airspace without somebody controlling where you were going? The goal of the Air Traffic Control Center is to get the right plane to the right runway at the right time. And our goal is right patient, right bed, right time.
We knew we needed to do something to improve efficiency, coordinate care, and really maximize the use of our precious bed. The command center helps bring patients to us so we can provide the life-saving care for which we are known.
We can be sure the patients who need to be at the Johns Hopkins Hospital can be here when they need. The screens that you see are not just pretty pictures. They're used every minute of every day, and behind them is some very sophisticated technology.
Walls and walls of monitors streamlining data on who needs services, what our bed status is. Historically, we have reacted to demand for our beds. Through the use of predictive analytics, we will be able to anticipate that need and
I think that we were very fortunate to actually have mission control up and running prior to COVID, because I honestly don't understand how we could have operated without it. Mission control allowed us to track patients with.
The facility that you're walking into right now is our Network Operations Command Center. On our left-hand side, we have our transfer call center nurses and staff. They're talking to physicians at our campuses.
Welcome to another episode of the Healthcare Futurist. Imagine a busy hospital where thousands of patients arrive daily. Some come with appointment, some come without appointment. Many people come to the emergency room department seeking treatment for a wide variety of medical conditions, surgical conditions. Some need surgery. The staff, consisting of the doctors, nurses, and other healthcare professionals, they work 24/7 to provide the best care possible, all while navigating the complexities of a dynamic and unpredictable environment. A lot of regulatory systems in place, and naturally, a hospital and treatment has quite a lot of public attention also. So how to manage all these without problem? Here comes the concept of what is called a hospital command and control center. In this episode, we will discuss a little bit about what exactly is this hospital command and control center, what is the concept behind this, and what are the opportunities and processes that can be streamlined through a hospital command and control center. In 2016, the Johns Hopkins Hospital in Maryland launched its command center as they were facing many operational challenges impacting quality of care. When the COVID-19 pandemic hit, many health systems adopted command centers which helped in managing the pandemic in a very efficient way, with a lot of real-time data coming in and managing bed availability, staffing levels, and patient journeys. So what exactly is a hospital healthcare command center? This is like a smart control center for hospital where they coordinate everything related to the patients. Instead of having different departments working separately in different parts of the hospital, this is a floor, a lot of monitors, a lot of data coming in, where they manage many things like patient transfer, bed management, transport, patient access. Command center brings everything together. This is done some virtually, some physically, and some mix of both. The main job of the command center is to manage actively how patients move through the hospital and then handle and coordinate related services. They use data which is available real time and use analytics using artificial intelligence and machine learning to make decisions on the spot. Now let us look at what are the components that make a healthcare command center. The number one is technology. At the heart of any hospital command center, or what is called an HCC, is a strong technology base. This includes good quality equipment, the ability to get real-time data from different parts of the hospitals regarding many aspects of patient care, a good software, good network. And the second thing is analysis of this data. It is very, very important to be able to look at the current data, look at the previous data, identify patterns so that one can predict many things that's going to happen. The third thing is regarding communication. They need to communicate with different parts of the hospital, different staffs, different systems. So communication channels, different types of communication channels is very, very important as far as HCC is concerned. And fourth is integration with the existing health care system or HIS. So this is very, very important because one should be able to get data from the existing HIS, then only the command center will work. Now let us look at what are the benefits of implementing a healthcare command center. The first and foremost is managing the patient journey inside the hospital right from the moment they come in, allotting beds, and coordinating multiple investigations for them, coordinating procedures like surgery, angiogram, etc. All these can be managed efficiently if there is a hospital command center. The second is the discharge time or the time they stay in the hospital can be significantly reduced. The discharge turnaround time can be reduced or the TAT can be significantly reduced. Then one can analyze which are the areas where there is shortage of staff or anticipated shortage of staff so that the staff can be managed appropriately so that there is no shortage of staff in any particular area of the hospital. Waiting times in the outpatient department can be managed efficiently. Availability of beds, like patients when they're waiting for admission, bed availability, especially in a very huge hospital, can be managed efficiently using the HCC. Transfer of patients to the operation theatre, back from the operation theatre. Then another advantage is watching the patients remotely. Remote monitoring of the patient becomes effective. In one of the previous episodes, we had discussed about remote vital signs monitoring, but this becomes effective. Care coordination is another area where HCC helps. Automatic alerts can help patients notify or the hospitals notify healthcare providers promptly about important events. Then when there is a remote monitoring, the teams can respond swiftly to changes in a patient condition, like somebody crashing, somebody having a change in his vitals. Immediately, coordination of care can be better done if there is an HCC and a control command center. Scheduling and communication. Command centers plays a vital role in automating the scheduling of appointments, procedures, resources, etc. So these are probably the 10 areas in which a command center benefits a hospital. Now, next, let us look at what are the benefits for a hospital to invest on a command center. The number one is the savings on cost. The advantage is there are many departments in a hospital which work in different parts of the hospital trying to manage the hospital. When all these are brought together under one roof, there is a significant reduction in manpower. And when the data becomes available online, many of the manpower required to analyze the data can be saved when there is a centralized command and control center. Once this command center is integrated with the HIS, the data can be easily accessed. Remote monitoring is another area where command center becomes hugely beneficial for the hospital. The operations of a hospital becomes much more efficient and optimized so that resources can be utilized much more efficiently. So in a nutshell, any hospital, and for that matter, if any hospital is planning an expansion or constructing a new building or planning a new hospital, a large area should be assigned to what should in future become the hospital command and control center. And depending upon the need of that hospital, many of the departments managing the hospital can be brought under one roof. And with the availability of remote monitoring of many of these activities, an efficient management of the hospital becomes possible with the hospital command and control center. Thank you. Please share your comments, opinions, and your thoughts on the Healthcare Futurist. See you next time with another episode of the Healthcare Futurist.